Hi, I'm Adam Turtletaub, Vice President of Strategic Initiatives and International Programs at the Healthcare Compliance Association and Society of Corporate Compliance and Ethics. I am joined today via phone and Skype by Theresa Defino, who writes and edits the report on patient privacy. Theresa, first of all, thank you for joining us. And secondly, can you share with folks more information about yourself and your background?
Sure. I have been writing a report on patient privacy since 2006, and before that, I started out in daily newspapers and developed a specialty in medical writing. I worked in a hospital PR department, and I also worked for WebMD. So, as I say, I've come to this newsletter since 2006.
So, in the 12 years you've been writing this publication, what changes have you seen in the whole landscape of privacy? I mean, it's quite a lot, I would imagine.
Yes, I mean, in some ways, very little has changed. That HIPAA covered entities have the same job of securing patient privacy, which means everything from not dumping their patient records in dumpsters to making sure that doctors are not gossiping in the hallways about their patients. But they're contending with these malware attacks with new wearable mobile devices that patients are wanting to collect data and send it into their patient records. So there's an awful lot that they've got to keep up with, but not forgetting their missions.
And obviously, as you mentioned, people really have become much more aware of this issue. Aren't there many places compliance officers can read to go about HIPAA compliance issues as a way for them to stay aware of these issues? I mean, there's daily headlines about privacy issues. You can't turn around these days without it being in the news. What makes the report on patient privacy different and so important?
So it's true that there is a lot of news because the Office for Civil Rights now requires breaches to be reported publicly. But as a monthly publication, I'm able to go behind the headlines, figure out what the breaches were about, how to prevent them, really give people an idea of what they need to do to comply even before regulations are coming out. And then when the regulations come out or guidance, I'm able to draw on my expertise and show them exactly where there might be trouble spots or where they might need clarity, where they need to spend money and where to make changes. So I'm really able to give them much more than a free headline they can read on the internet somewhere.
Interesting, and that does count for a lot more value than just whatever just happened in the last day. So, what sort of changes do you see affecting the HEPA field in the future?
As I mentioned, the mobile devices and the increasing threats are changing their landscape, but at the same time, the Office for Civil Rights is saying that it's going to continue enforcing in a multi-million-dollar way, so they've got to keep up with whatever the Office for Civil Rights is doing. But the biggest challenge is that the government is always behind in terms of what it can regulate, and so in many ways this is very uncharted territory for covered entities, and they're going to have the advice and information that people such as myself, with my depth of knowledge and good sources, can give them to really keep them in compliance before the government comes after them.
Well, it's great that you're there and doing this, and I think you're right. I think there's always a lag between what happens in the next set of regulations, but we all have to be prepared for what's coming next. Well, Theresa, thank you so much for taking the time to talk to us today. Thanks to all of you for watching. It was a pleasure to speak with you, and hope you'll consider subscribing to Report on Patient Privacy.
Thank you, Adam.